Ozone therapy, it's another way to get highly reactive oxygen into your body, and it actually works by giving the body a way to get oxygen into those cells, your mitochondria. You guys remember from fourth grade, mitochondria? You know, that's where this is the powerhouse of your cells, right? So inside the cells there, you will actually find that they need oxygen to start what's called the electron transport chain. It's a conveyor belt on how we actually go from oxygen and to produce what's called ATP. Fancy, smanchy words for basically the currency of your energy. What is your body using as energy? So by getting the oxidative therapy, what you're doing is that you're actually boosting your own body's ability to start working better. You're increasing the energy inside of every single cell of your body. So it's another way of getting it in directly with the blood versus when you're just breathing it. Because when you're breathing oxygen, which is an O2 molecule, it has to go through the lung and the lung tissue, and it gets into the blood that way. By getting it in with ozone therapy, which is a highly reactive oxygen, you're forcing the oxygen into the cells quicker, and by going directly to the blood cells. So it's not associated with the air and the breathing in that sense. We just see that people basically do a lot better on it. I'll give you an example. I had a patient coming in here with chronic jaw pain that she'd had for 5-6 years, and nothing had touched it. We put the needle in her and started doing it in the middle of the treatment. What we were actually seeing was that, I mean, she was just like, my pain is going away. What is this? What's going on? That doesn't happen for everybody. But sometimes pain and things that are just stuck is stuck because there are no cellular activity, meaning that you have parts in your body that doesn't have any energy occurring. It's like there's an empty house, there's an empty cell, it's retired, it's just hanging out in one place over here, nothing is happening. What happens there is that it's almost a little dead tissue. And sometimes that can create aches and pains. So the other way of looking at that is that we're activating the tissue again to bring back life into it. So we use a lot of that oxidative therapy to basically increase your own body's ability to heal. Does that make sense? Okay. So that's my little spiel on oxidative therapy. Do you guys want to hear about the Myers cocktail? I know some of you don't want it. So the reason for why we do that is that because a lot of people come in and they have basically deficiencies in nutrients, vitamins and minerals, and they don't realize that they don't have these. There's such a low levels of it that your body, again, is not working the way it should. So the way to make sure that your body can get as much benefit as possible is to prime your body with these nutrients to allow the body to get that optimal function back. So by doing one of those Myers bags, and I wish it was named after my last name, but it's nothing to do with me whatsoever, it actually has to do with, it's like taking a month's worth of supplements and getting it in one IV bag. For some people, it's not a full month, but you get the idea about it's like you're getting saturation of the tissue in such a way that you're getting more nutrients into the areas that's needing it. And you really get the tissue waking up and actually start healing again. Now, some of you can't do it because of certain medical conditions, but we just also notice that people do a lot better and usually have much better results when they do this. Again, I can give you an example. On one of these 3-day programs, we had a lady in here for fibromyalgia, of all things. Now, the nice thing about people when they're in pain, it's easy for me to tell if it's working or not, because when the pain goes away, we know something happened. So for her, it was a matter of getting her the nutritional deficiencies, and most fibromyalgia patients are very low in these energy pathways that creates ATP. Remember the currency of energy that we have in our bodies? And she got the ozone and she got the Myers cocktail, and that was pretty much what we did for her. And 3 days of that, and she was out of pain again for, she could not remember the last time. It was like 20-some years she's been with fibromyalgia. So it is easy to see how it works when you walk into something where you have pain and the pain goes away. For an eye condition, it may not be as easy to see it right away, but that's why we do baseline testing before and after. And what we have seen is that people who do this full program usually have a better results when they have the testing before and after done. But again, those are optional treatments. Okay? Any questions?
So what's treatment like this ozone therapy? Would it come back again if you stop the treatment?
What do you mean, would it come back again?
If you stop,
Well, a lot of the times, though, is that when you're giving the ozone, the activated oxygen into the tissue, is to reawaken that tissue again and saying, hey, come on, come back to life. Now, the length and how long it lasts, it depends a little bit, because if you continue now getting more nutritional sound, get on the corvalin, which is a powdered form of, again, supporting mitochondrial function. You're going to hear ribose or ribose for some of these people. It's in your little drink in the morning. It also supports what I call the electron transport chain. Has to do with that mitochondria again. Creates ATP, which is that energy. So that helps you sustain life in those areas, in those cells. That's one of the reasons why we tell people to actually get on that. We woke it up, now we want to keep it alive, type of things. The other thing that happens is that when you feel better and you are doing better, very often you start moving around a little bit more. As you are moving around and getting a little bit more exercise and all of those things, you actually are also increasing blood circulation and you're increasing oxygen uptake. So that's another way to support it. Some people do find practitioners in their home area and do more ozone on a regular basis. So that's another way, though. But how long it's going to last for each and every one of us, it depends on how deficient you were, how deprived was your body for these things. What we know is that it actually boosts your ability to do self-healing.
Is there anyone who shouldn't do it?
Shouldn't do it?
Shouldn't do the ozone.
Shouldn't do the ozone? I have yet to meet somebody who it's contraindicated in.
Is what?
I've yet to meet somebody who shouldn't have it. Yeah.
Okay.
I mean, we do it on each other here in the office all the time, and it's just the first line of defense if people get a cold or do something like that. And I had patients in who treated with pneumonia. We did Myers, we did ozone, and we did microcurrents, and we have lab results showing that before and after, no pneumonia type of thing, no antibiotics, no need for anything like that. It actually was originally used for tuberculosis. So, and it has been tested. Researchers from Scripps Ranch in 2002, I believe, looked at ozone therapy to see if there was something about it that was bad or it was doing something funny, and they found out it was only beneficial results and that it should be encouraged to use more often. So absolutely something that I hope that the general medical practice is going to pick up on and use more. There's different ways of giving it. There's IV, which we often do here because it's just easy for you to see that your blood gets oxygenated. It's rectal, which is easy to do for self-care and home treatment, particularly if you can get your own machine. You get little bags, you can fill them up, and you can give yourself a rectal ozone therapy. There's intrabulbar. I don't do that. That's what Dr. Conrad is for. He actually injected in the eye, and that's appropriate for certain conditions. Is there anything I'm forgetting about ozone? Other ways to get it in? Saline. Saline eye drops. Problem with saline sometimes is just that stability. It has a stability of about 24 hours, then you have to remake it. So again, you're dependent on having your own machine. But we see people doing very nicely on saline drops for the eyes.
Maybe if any of you are interested and you want some saline eye drops, because I think the saline eye drops can be very effective in helping your eye.
People will report back as just feel clearer mind, clearer thinking, clearer focus. For those people who don't have visual problems, also can just take this and just feel like they're getting a clarity and just everything seems to brighten up a little bit. Headaches can go away with that at times, depending on what's causing the headache.
I was going to try it because I developed a sinus thing.
Yeah, and that's the other thing too. And I do have other things for sinuses too. So yeah, so we can fix that. But ozone is actually it's almost limitless on where you can use it as long as it's administered correctly. It is not just going in a room and inhaling ozone. That's not what you want to do. You actually want to make sure that it gets into your body in the right way.